Daktari?
I'm fine, thank you.
Yes,
How are you?
I'm fine too.
Yeah.
So yes, Dr. Lois, tell us something small about you. Who is Dr. Lois?
Okay. My full names are Dr. Lois Mwangi. I am a consultant ophthalmologist. I work at PCA Kikuyu Hospital and I teach medical students at Jomo Kenyatta University. I am passionate about eye health and living healthy. So what I do on my free time, I take long walks. Yeah.
It's lovely.
Yeah.
So today we're talking about glaucoma. So kindly tell us something small in simple layman's language. What is glaucoma?
So glaucoma is a blinding or a vision-threatening disease. It is a disease that affects the nerve that comes to the eye. We call it the optic nerve. And a lot of the patients with this disease are found to have high eye pressures. So there's the normal pressure for blood pressure, but there's a pressure in the eye. We call it intraocular pressure. A lot of the patients with the blinding disease called glaucoma have high eye pressures that press on the nerve that comes to the eye. We call it the optic nerve, and it causes a degeneration of the nerve, thereby causing vision loss.
Okay.
Yeah.
Okay, that's good. And what are the primary risk factors for developing glaucoma?
Okay, so the main thing is genetics. So you're either born with a predisposition to get glaucoma or not. That's the main thing. So we can find it sometimes running in families. And we do say that we who are of the black race are at higher risk than people of the Caucasian origin or race. So black race is one. And we also find glaucoma occurring in patients as they grow older. So age is a risk factor. So we say that you need to be screened for glaucoma from the age of 30-35, especially so if you're of the black race. Yes. Other risk factors, like we do have a small percentage of glaucoma occurring in children. That one is most of the times genetic.
Okay.
Yes.
Okay. Okay, I was going to ask about glaucoma in children, but you've touched on that, unless you have something else to add on.
Yes, so you can have a small percentage of glaucoma occurring in children. Sometimes children as young as the first few days of life or as infants. And there's also something we call developmental glaucoma that will occur in patients from after the preschool age all the way to now the age of 30-35. That is called juvenile glaucoma. So we have children who get what we call congenital glaucoma. Those ones will present very early in life. They will present with big eyes that look white in appearance, and they have a lot of tearing. So it's an encouragement for mothers or relatives of such babies to present them early for treatment or management in an eye hospital.
Okay. Is it reversible?
I would not say reversible. I would use the term treatable.
Okay.
So we can manage glaucoma both in children and adults. Key thing is early detection, then early treatment to delay progression of disease.
Okay.
Yes.
So as we talk about treatment, are there any advancements that have been made in treating glaucoma in the early days?
Okay, so the main management of glaucoma has been medical management using eye drops. And the truth is that once you're diagnosed with glaucoma, you're going to need to put eye drops for most of the rest of your life, unless a surgical intervention is used that would now relieve you from putting the eye drops or reduce your burden of eye drops needed for treatment of the glaucoma. So if I'm to answer you, so the original management of glaucoma is medical management in the form of eye drops mostly. And then there are surgical interventions for glaucoma, and these have had different advancements over the years. So there is a primary surgery that does not include any devices, that can just be a modification of your current eye to increase the outflow of the water inside your eye through a different route. So that surgery, we call it a trabeculectomy. And now out of the trabeculectomy, there have been other advancements that would aid in drainage of fluid from within your eye back into the blood system. So we have now glaucoma drainage devices that are used for the same purpose. So those are the advancements, and they are numerous in number. Yes.
From these treatments and the various other treatments, are there any side effects that come with the treatments for glaucoma?
Yes. So the medical management, as is with any medicines, is not without some side effects. Although most of the eye drops and the side effects that they would induce are not side effects that are not manageable. Okay. Special mention would be if you're diagnosed to have glaucoma and you're an asthmatic patient, it would be important to let the eye specialist know that you're asthmatic, because there are some eye drops that we do not use in asthmatic patients. Okay, because those eye drops, when absorbed into the system, sometimes can trigger an asthmatic attack. And the other side effects are specific to the other groups of different medications that we use in the eye, and most of them are localized to the eye. So there are some medications that you can use that are meant to lower your intraocular pressures, but they cause you to have red eyes, very teary eyes. Sometimes they even cause you to have longer eyelashes. Okay, but that is not something we can not manage. If we do find a patient reacts to a particular medicine, we can always change it to something else that would control the intraocular pressures without causing the side effects. Some of the eye drops can also be absorbed into the system and cause what we call our central nervous system depression. So those ones would make the patient drowsy, and we especially avoid such eye drops in using children because of that central nervous system depression that would cause, because when you're an adult and you're drowsy, you can tell, but when a child is drowsy, sometimes it can cause all the way up to sleep apnea. So those ones we avoid completely in children. May I also mention that glaucoma in children is mostly managed surgically. So if we do find glaucoma in a child and we start them on eye drops, it is usually just to lower pressures enough for the surgical intervention to be done by the doctor. So it would be a short-term measure to lower the intraocular pressure to allow us to be able to manage the child surgically. Yeah.
I think that's good. We've learned a lot from you. Maybe you can give us a close-up message on our glaucoma week.
Okay. So coming up soon is the World Glaucoma Week. We normally celebrate this or commemorate this every year in the second week of March. It is mostly aimed at creating awareness on this vision-threatening disease that can rob you of your vision slowly until when you cannot see. And we normally say for glaucoma, when you cannot see, we're a bit late in intervening. So this week is aimed at making people aware that there's a blinding disease that is called glaucoma, which when detected early, it can be controlled in a way that it doesn't have to rob you of your vision. And so this year we are theming it as uniting for a world free of glaucoma. It is possible, and what we encourage is please come early, have an eye checkup from the age of 30, at least once a year. Every credible eye health worker would know what to do with you when you present and you say, I'm here for glaucoma screening. And in the week of World Glaucoma Week, most of the eye centers across the country and across the world actually will be carrying out free eye tests. In the event that they detect glaucoma, then they would start you on treatment in good time so that you don't have to lose your vision to glaucoma. Thank you.